10 highly addictive drugs. There are a variety of dangerous, addictive drugs out there. Understanding which the most addictive substances are can help you understand whether you or someone you love is at risk for addiction. 1. Heroin. Heroin is incredibly addictive because it binds with opioid receptors in the mind to stimulate pleasure by releasing dopamine in a way beyond what the body can produce on its own. Once the person stops taking heroin, the body is not able to produce dopamine for a period of time, which causes a variety of symptoms, such as depression, nausea, physical pain, and hallucinations. To avoid these symptoms, the person will continue taking heroin. 2. Crack cocaine. Crack cocaine is a type of cocaine that is smoked. This variety of cocaine takes effect faster and creates a more intense high. At the same time, this high reduces rapidly, in about 10 minutes, and increasingly higher doses are often necessary for the person to experience the same high. As crack wears off, it causes increased depression, anger, and anxiety. 3. Nicotine. Studies have shown that nicotine stimulates the activity of the neurotransmitter, nicotinic, in the brain, which makes it necessary to go on taking nicotine. This is why severe withdrawal symptoms are common when people try to quit smoking or chewing tobacco. 4. Methadone. Methadone has been used widely in opiate withdrawal cases because it is a healthier and cleaner alternative. It is an opiate, like heroin, but less addictive. In a medical setting, methadone use is carefully monitored and gradually reduced to reduce withdrawal symptoms and to eliminate the risk of addiction. However, addiction is still possible. 5. Crystal meth. Crystal meth is an alternative form of methamphetamine that teaches the brain to crave it. When a person smokes crystal meth, the dopamine and norepinephrine-producing areas of the brain are stimulated, enhancing the feeling of alertness. So crystal meth users often feel more focused. That helps them perform a task more efficiently. However, the brain becomes dependent on these artificially increases. In addition, crystal meth damages the neurons that naturally produce these chemicals. Hence, crystal meth addicts may end up having a permanently decreased ability to feel pleasure and focus. 6. Barbiturates. Barbiturates are depressants that were earlier used to treat anxiety but now have been replaced by benzodiazepine. They are still sometimes used to treat epilepsy. Addiction to these substances is likely, and withdrawal is similar to alcohol withdrawal, such as cramps, seizures, nausea, vomiting, anxiety, and even hallucinations. 7. Alcohol. The legal and social status of alcohol fuels its potential for addiction. Consumption of alcohol makes the body release high levels of endorphins and dopamine and makes them feel happier. It also reduces anxiety and self-control, making socialization easier. Unfortunately, alcoholics become dependent on it to release endorphins. Alcohol withdrawal symptoms are among the worst, and can actually cause death in severe cases. 8. Cocaine. While cocaine is less potent than crack cocaine, it is still dangerously addictive. It stimulates dopamine release, which is only temporary, and makes the person crave cocaine at high levels. Its effects, its quick nature of use, the potency of its high, and the rapid development of tolerance make its addiction potential severe. 9. Amphetamines. Amphetamines are stimulants that are used for a wide range of medical purposes, increasing energy, treating sleep disorders, and helping with ADD and ADHD. Adderall, dextrin, and disoxine are common prescription forms of amphetamines. Methamphetamines are an illegal and non-medical variety that can cause problems with speaking, dry mouth, dizziness, constipation, insomnia, and heart problems. It can also cause addiction due to increased levels of dopamine and other endorphins. Such levels of these chemicals cannot be naturally sustained, and this leads to a dependence on the drug. 10. Benzodiazepines. Benzodiazepines are usually prescribed for anxiety, to help patients achieve calmness and stability. However, these substances are highly addictive substances, because the mind can become dependent on them. Withdrawal symptoms include severe anxiety and panic attacks, though physical reactions, such as nausea, may also occur. If you suspect that you or a loved one is becoming dependent on any drug, seek help at a reputed rehab right away.